Welcome back, you're watching Morning Live. We're going to turn our attention now onto health and health in the Gauteng province in particular. Practitioners in the province are suggesting ways of improving the health system. This follows an announcement by provincial Health MEC Qedani Mahlangu that 33% of the 2015-2016 financial year would be allocated towards the provision of primary healthcare. Graham Anderson, the CEO and Principal Officer at ProfMed, joins us now to discuss this a little bit further. A very good morning and welcome to Morning Live.
Good morning, Vadi.
Okay, so tell us how important this 33% allocation actually is for that primary healthcare sector in the province of Gauteng.
Well, I think if we take into account the fact that primary healthcare is where the rubber hits the road, it's where people access healthcare all around the country, particularly in the rural areas. So I think it's vitally important that a large chunk of the budget goes to primary healthcare, because people, the population that live in those areas need to access this primary health care for their preventative health care and to get medication on a regular basis and to see general practitioners and nursing sisters and to take their children to clinics there. The babies need to get their immunizations. So primary health care is really very important, and it's very important that the primary health care clinics are well stocked. Some people travel miles and miles to get to these places, and when they get there and they need to have immunization for their children, or if they need medication themselves, it's very difficult for the staff that work in these organizations to deal with these patients if they don't have the right stock available. So I think it's vitally important, and I think that MEC Mahlangu has done a great service to the public in Gauteng by allocating 33% of his budget in that direction.
It certainly is important, because when you speak about stock shortages, it's unfortunately a story that we hear all too often coming from our major hospital also in the province, is this thing about stock shortages.
The MEC, in fact, in his budget speech, spoke very strongly about taking action against those companies that are contracted to supply the health department in Gauteng with medication and surgicals. To make sure that they are allocated sufficient resources so that they can get these medications and resources and surgicals that they need in these clinics. Not just the primary healthcare clinics, but as you rightly say, in the secondary and tertiary hospitals as well.
What is your take on health practitioners that say private medical aid is to blame for the poor public health care?
I don't know where they get that from. I think that medical scheme or medical aid purchase is a grudge purchase. Having said that, the collapse of the medical scheme industry in this country would result almost in a failed state. Because if you think about it, the medical scheme industry funds people's health care. And how many people would be able to afford to go and have a hysterectomy, for example, in a private hospital at 80 or 90,000 rand if they didn't have a medical scheme? And quite frankly, the public service is not in a position to take up that slack if the private sector had to collapse.
I mean, one would say that primary healthcare is, because obviously this is where this 33% allocation is now going, one would say that because it's the first tier and almost the one that's so necessary in order for people not to get so much more sick and have that the need for hospitals. I mean, has it been an area that has been overlooked?
I don't think it's been overlooked. I think the clinics have always been there. The primary healthcare clinics have always been there. I think that they've been short on resources, both financial and human resources. And I think that that's been the problem. And that's why I think that the MEC has allocated such a large portion of his budget to that, so that we can get the medication and the surgicals in those areas, but we also need to have sufficient healthcare staff in those facilities, because people travel a long way to access these facilities. They queue for hours, and they need to be able to be dealt with in the day that they arrive and not have to come back the following day.
The other thing is, will it be enough for the need that is in Gauteng?
I think it's a start. It's a good start. It's never enough. Healthcare, there's never enough finances for healthcare. I mean, the MEC also allocated 69 million rand for the upgrading of Qedani Mahlangu Hospital. That hospital is in a desperate need of upgrading. And is 69 million rand going to be enough? Who knows?
Yeah, that is always the question of just how much money is enough. But like you say, something at least going towards that primary health care. What's the impact of the lack of professional staff in upgraded facilities? I mean, you mentioned the skilled personnel. Has there been any talk about upskilling people and making sure that the money that is going there is going to be well used?
I think when we're talking about the primary healthcare, I think the most important healthcare profession in the primary healthcare space is the nursing staff. And for many years, we didn't have nursing training facilities, training colleges for nurses. The Minister of Health has recently made the decision to reopen a lot of those training facilities, and I think that that's going to go a long way towards providing nurses at these facilities, because nurses, after all, are the first port of call for the patients in these primary healthcare facilities.
Being in the sector that you are, what is one of your major concerns and the challenges that you see people in South Africa are maybe not speaking about when it comes to medical, to medicine and to healthcare in South Africa?
I think the human capital is the biggest problem that we have in healthcare. I don't think there are enough nurses, I don't think there are enough doctors, and there certainly are not enough specialists. Unfortunately, we're training doctors and a lot of them are leaving the country. So I think that the biggest challenge that faces healthcare in this country is human capital.
And is it being noticed by the decision makers and those at the top that have an opportunity to change that?
I certainly think so. That's the reason that the Minister is reopening nursing colleges. I know that there's a bigger intake of in the medical schools. The problem is we need to make sure that the medical people that we do see graduate in this country remain in this country to treat South Africans.
Lovely stuff. Thank you very much. That's the CEO and Principal Officer at Prof Med, Graham Anderson, just chatting to us about so much regarding healthcare, not only in Gauteng but also in the country. Stay with Morning Live, your full news bulletin at 7 o'clock coming your